All right. A very good day to Madam and to everyone listening here today. This subject is BCM 3253 Data Analytics and Visualization from University Malaysia Pahang. I am J. Sharuban, son of Kripakaran, and my metric ID is CB18058. So today we are going to look at a small rundown on the analysis of the study that I have did for my data analytics and visualization project, which is the analysis of COVID-19 cases and deaths in all states in Malaysia. So first and foremost, let's cover on the organization point. The organization that we have chosen here is the Ministry of Health Malaysia. The motto of MOH is "We're ready to help." The vision for MOH is a nation working together for better health. What about the organization? Ministry of Health is a ministry under the government of Malaysia that is responsible for health care system in Malaysia. This ministry is formed in the year 1963 and currently managed by the Minister of Health, Datuk Sri Liao Tiong Lai. The missions for the MOH is to facilitate and support the people to attain fully their potential in health, appreciate health as a valuable asset, take individual responsibility and positive action for their health, to ensure high quality system that is equitable, affordable, efficient, technologically appropriate, environmentally adaptable, customer centered, innovative, with emphasis on professionalism, caring and teamwork value, respect for human dignity, and community participation. Here are the problem statement of this study. Big data from thousands of sample data coming from multiple states can confuse the Ministry of Health's decision in managing the rampant cases of COVID-19 in Malaysia. Number two, the government are facing a tough time managing the movement control order for states in Malaysia. Particularly states are in higher risk, but similar action is taken due to the excessive data inputs that are scattered and untreated. Basically, the government can't take action on specific states since all the data is too much and is scattered and untreated. Number three, raw data as a numerical type may reduce precision as well as accuracy to solve problems or findings in producing a conclusive hypothesis for COVID-19 cases in all states in Malaysia. So this is the dashboard that I've done. 5 sheets of 4 bar charts as well as a pie chart to represent all these studies or all these rows and columns that I've made to represent different types of data which are beneficial to the Ministry of Health to make particular decisions. Bar chart 1, number of ICU patients and patients in need of breathing apparatus by state. This diagram shows a bar chart for the number of ICU patients in need of breathing apparatus by state. Thus, to create this bar chart, the location of states are matched with the two which are ICU patients reported and what numbers of patients are actually in need of breathing apparatus. This will clearly show us the statistics on the number of critical ICU patients in need of breathing apparatus. We can see on the left, there's a value section, the top, the states, as well as down, the number of ICU cases, as well as patients who are in ICU that are in need of breathing apparatus. Number two, COVID-19 confirmed cases, statistics by states. Pie chart number 2. This pie chart shows COVID-19 confirmed cases statistics by state. Thus, to create this pie chart, the location of state is matched with confirmed cases of patients. This will clearly show us the statistics on the number of confirmed cases by state. Here, we implemented colors to differentiate all 16 rows of locations, all 14 states with 2 districts, namely Johor, Kedah, Kelantan, Kuala Lumpur, Labuan, Melaka, Negeri Sembilan, Pahang, Perak, Perlis, Pulau Pinang, Putrajaya, Sabah, Sarawak, Selangor, and Terengganu, namely Labuan and Putrajaya being districts. Number 3. COVID-19 confirmed cases and deaths by state. Bar chart number 3. Here shows a bar chart for the COVID-19 confirmed cases and deaths by state. Thus, to create this bar chart, the location of state is matched with confirmed cases of patients and deaths of cases of COVID-19 patients. This will clearly show us the statistics on the number of confirmed cases by states as well as its death toll number by state, whereby we can assess this risk of each state by its severity and death tolls. Number 4, COVID-19 mortality percentage and mortality rate by state. Bar chart number 4. This diagram shows a grouping of bar charts for the COVID-19 mortality percentage and mortality rate by state. Thus, to create this bar chart, the location of state is matched with mortality percentage and mortality rate by state. This will clearly show us the statistics on the numbers of mortality percentages and their rates by states. To this, we can clarify the percentages of each risk on its state has of COVID-19 mortality and assess the risk of states by its percentages and rates. Last but not least, bar number 5, COVID-19 death numbers past 10 days by state. So here it is recorded from 20th May up until 30th May, 10 days of the past days in the May 2021 region. Here we can see that at the top it is flanked by the names of states as well as the death toll numbers, and it is also signified by different colors matched by the pie chart values as well. Based on the dashboard created, from your opinion, what is the major action to be taken by the organization to make the organization much better? So I would say, my opinion, the action that has to be taken is risk tagging. Specify each state's risk of COVID-19 exposure to warn and educate people who are in the states. Next, breathing apparatus financing. Selangor is recording the most number of patients in need of breathing apparatuses in ICU wards. The MOH has to provide more financing amounts towards these cases and to treat people who are facing this issue. C. Improve healthcare. COVID-19 confirmed cases that leads to death is increasing and is highest in the Selangor state and namely other states as well, especially Sarawak and Sabah. Thus, what can the organization do? They have to improve the healthcare system and to provide even higher quality of medical supplies and treatments for the people who are affected. Last but not least, the next action that can be taken is to tighten movement control order regulations. States that record top 5 cases of positive COVID cases must be implemented with a higher or maybe a tighter standard order procedures through movement control order, which means that these SOPs have to be followed in a more strictly manner than before. Suggests how the organization should get more reliable data. Number 1 is to use online surveys by collecting both quantitative as well as qualitative data. Why? Because implementation of these collection of two data can improve the accuracy of data, reduce anomalies, reduce standard deviation of data, as well as avoid any inaccuracies of sample data collected, since managing the states that are affected by COVID-19 is very important to the country of Malaysia. Number 2 is normalizing one format of data collection. Normalizing a standardized format for data collection. In this case, we are accepting quantitative and qualitative data with similar rows and columns. Allows us to have the ease of integration and speed of formulation of these analytics. The buffer time for data cleaning required if data is collected from various formats can take more time than usual to produce COVID-19 analytics results. This can hinder the government's action or maybe prolong their action, and prolonging time in an outbreak like this can cause more casualties than saving them. In conclusion, my opinion about learning this subject. First of all, factual knowledge. I've learned a lot about data analytics techniques as well as visualizing it in a right manner. In this way, we can clearly make well calculated analytical decisions based on real time data to have a better chance in taking uh, better solutions to the problems we face. Practical implementation is number two. We have a real world application of data visualization tools like Tableau. So, a system like this, which is also currently being implemented by companies in various industries, enables us to have a good exposure to these systems. Communication is number three. Learning as a team to communicate in class when any doubts are there. I've learned to work in a team. I've learned to communicate with students and peers that are in the subject to learn a better understanding of the subject. Last but not least is confidence. I've learned this factor as well because it improves my ability to produce data driven reports with exceptional accuracy and understandable visualizations. This makes me feel that I have the ability to do analytics and to provide conclusive statements upon good data collection as well as cleaning to provide full accurate hypothesis at the end of any analytics. So with these factors into mind, how does this impact my future? So with this knowledge, I can apply to data related professions like business intelligence analyst, data mining engineers, data architects, data scientists, and many more. So the data analytics and visualization subject has been much of a pleasure for me to learn, and and for the lecturer to give us so much opportunity to expand and learn on the subject. And I would definitely dive deeper as soon as my program ends and to understand what data is about and how visualization can bring meaning to data itself. So that is all from me, and it's been a pleasure doing this project. Thank you very much and have a nice day.